After my interview at Salem Hospital, I was just in love with the program for everything that it had to offer. First, the exceptionally well-rounded curriculum that I think is one of the most important aspects of our training. Second, the robust clinical experiences that we get to have on a daily basis at Salem Hospital. And most importantly, the amazing people that I met during my interview day. I loved every single one of them. I felt that I would be part of a wonderful family. And I think this is one of the most important things for the next 3 years of my life.
The residency is a very close-knit culture. We know our residents extremely well, and I think that's one of the benefits of training here at Salem Hospital. Salem Hospital has sort of the best of all worlds. It is a community hospital dedicated to its community of patients, and we are very proud of that care and care very much about our patients. But at the same time, it's a large enough hospital where we see high acuity in the intensive care unit, on the wards, in the cath lab, in the emergency department. And also, though, a place where everybody knows who everybody is, and it's a first name basis type of hospital. And this all translates into a wonderful training opportunity for our residents. They get the amazing exposure that our patients provide, while at the same time in a close-knit, supportive environment. Supportive amongst each other, and the residents step up all the time to support each other, to ask how each other are doing, to advocate for themselves, but also supportive from the perspective of the teaching faculty and the administration, who take a lot of pride in caring for our residents and knowing them extremely well.
To me, the personal growth as a physician is probably a combination of the quality of the training that you receive and also the resources that the program is able to offer. In terms of the quality, we see a very diverse population. We see well beyond the bread and butter of medicine. And in terms of the resources, I think the association with Mass General Brigham pulls in a lot of resources that other community hospitals are not able to. Whether it's your interest in research or even in terms of pursuing fellowship, I think it just opens a whole lot of opportunities for you.
Every fifth week, our residents have half a day dedicated to process improvement. They are divided in teams and they conquer different projects based on the topics of interest from them and based on the hospital needs. They learn part of the half quality improvement day, how to interact with each other, how to interact and how to utilize Salem Hospital resources, how to ask research questions, and how to tap into the research resources and guidance we have from Mass General Brigham.
At Salem, we really care about trainees becoming really excellent physicians, but we also care about them becoming really excellent leaders. And we've developed a leadership curriculum here to teach them skills for teaching, time management, and wellness in their personal lives, because how you do at work affects how you do at home, and vice versa is true as well. And so we try to get to know people on an individual level and make sure that we're broadening their horizons at work, at home, and their personal lives.
Our continuity clinic preceptors are actually some of the mentors that we get to know the best because we see them every 5 weeks. They can really watch us grow, and their periodic feedback is really, really helpful to me. My preceptor especially has been really focused on helping me grow as a whole physician, not just as a PCP or as a clinic provider, but we've been doing, each session we've been reading a book that's tangentially related to healthcare, and we have a little book club about it. We've gone out to dinner. I have found her to be, it's one of the more important professional relationships to me.
I think Salem Hospital offers an excellent training environment, an environment where we'll treat complex patients, acutely ill patients, both on the medical wards and the intensive care unit. I think compared to other community programs, we really see a lot of diversity here, and that always keeps us on our toes and presents us with challenging cases. I think that in addition to that, our affiliation with Mass General Brigham really enhances our experience as residents. you'll be, as a resident here at the program, you'll be partaking in rotations at some of the tertiary hospitals in Boston, that really helps to complement your current training. And it really provides you with a lot of opportunity for research, for electives that may help you achieve your fellowship, for those that are interested.
I think one of the benefits of being here at Salem is that it's a small program. You work really closely with each attending, and you get a lot of autonomy. So I feel like I've been most supported in my growth as a physician by giving me enough leash to figure out what decisions I would make before going to the attending to discuss what decisions they would make. And more often than not, we go with the senior resident's decision. And so for me, that gives me a lot of room to grow and learn and figure out how I want to take care of my patients in the future.
So the way that we interact with the nursing staff in hospital is they're included in our MDR rounds, our multidisciplinary rounds. So their input is very valued and it's heard amongst the residency team and the whole physician team as well. So we interact with them there. We also interact with them one-on-one with each patient too. We're in constant communication throughout the day. They're very helpful. Also in outpatient clinic, we interact with our nurses. So if a patient needs help with medications or sometimes follow-up after the visit, we get in contact with our nursing staff who's able to kind of help with that follow-up in particular with this patient.
So Salem Hospital, one of the things that offers that I think we are really strong with, it's that we are a multicultural hospital. We have people from everywhere. And a great example of that is the residents. They come from either Dominican Republic, Colombia, Pakistan, Turkey, from all over the world. And I think that's really important because especially here in Salem Hospital, our patients are really diverse. We have Hispanic, we have Russian patients, we have from every race that you can think of. And I think that that's one of the strengths of this hospital. I don't think the patients feel comfortable when they come here. They don't feel that we're treating them different because of their color of skin or their economic situation. So that's something that I do value from working here, and I appreciate it too because my family lives around here and they feel that way. So I think that that's the biggest strength that Salem Hospital has to offer to all the patients around this area.
As a prelim here in Salem, I think it's a really strong program because it believes in the power of flexibility and they recognize that not all interns have the same goals. And I has been able to tailor the curriculum and even tailor my rotations in things that are going to be more useful for me and for my case. I can even choose electives like ID or rheumatology that for me, my future path as an ophthalmologist is going to be really helpful.
Our program leadership is very responsive to resident feedback. Over the last 3 years, I've seen huge changes in our program, all for the better. Our change to X+Y block scheduling, our reduction of consecutive night float time from 4 weeks to 2 weeks, and our implementation of novel curriculums including addiction medicine, point-of-care ultrasound training, and central line training have all been started by resident feedback. I think our program really values it and highly regards it.
The program has like an open door policy. You could walk up to the program leadership, the program director, the associate program director. You could talk to them and they always gives you valuable feedback. Everybody try to let you know what they're thinking about you, how they feel like you can improve, your weakness, the things that might be important, the things you might need for patient care. So this makes it's more relaxing. You don't have to think like, oh, what do they think about me? Where do I stand? They always communicate with you. And when you also have something to say, they listen to you, and they don't just listen, they actively do something to show you they add what you said and they're working towards it. So we have a very transparent and open communication, especially with the COVID pandemic and all the changes going on. They make sure we are on board with every changes before it's being implemented, which is very great.
What I enjoy the most when working with the residents, and most of the work that I do is in the intensive care unit, is seeing the aha moment from taking it from a patient situation and turning that into a learning opportunity and really seeing the light bulb go off and for them to understand a concept or a diagnosis or a treatment option in a way that it didn't before that very moment. That to me brings tremendous pleasure, and it reminds me of the privilege that it is to take care of our residents and to train them, and for the hospital's obligation to provide a sound training program. When you add up all those aha moments over the course of 3 years, you can really see the development of a given resident and of that cohort, and that is one of the most pleasurable things to see.
Looking back at the first week of my internship, I feel that I have grown so much in the past 3 months. I have learned so much, and I'm a completely different doctor. The program, I think, does an amazing job in allowing us to be supported but also autonomous enough to learn through our clinical experiences, and I think this is fantastic.